We're going to turn now to a highly contagious virus that's especially dangerous for babies. It is spreading right now.
Yeah, and doctors are really worried it's going to get worse. Kate Chappell's here to explain why. Kate.
So, Mary and Alex, rotavirus is a seasonal virus, so it is common this time of year. But some experts do say the surge is being driven by declining vaccination rates.
Until has more of his vaccines under his belt, we probably won't do a lot of airport travel.
Summer travel is on hold for the Rich family. Although 2-month-old Owen just got vaccinated for rotavirus, his mom Beth doesn't feel comfortable taking him in large public settings with so much vaccine uncertainty.
It's scary to think that other people in our orbit might be changing their minds and might be exposing our kids to more.
Rotavirus has been rising across the country since January, with infection rates higher now than this time last year.
Right, so today Owen is going to get his 2-month vaccines.
No rotavirus outbreaks have been reported in Illinois so far this year, but Owen's doctor, Dimple Damani at Pediatrust in Highland Park, is concerned declining vaccination rates could lead to even more cases next year.
Because there's uncertainty, because people are getting mixed messages.
In January, the CDC shifted the rotavirus vaccine from a universal recommendation to shared clinical decision-making, meaning it's up to providers and patients to decide, opposed to a blanket recommendation. Individual cases of rotavirus are not reportable in Illinois, so the specific numbers are hard to track. But Comer Children's Hospital has noticed a significant increase in viral gastroenteritis cases. Symptoms are diarrhea, vomiting, and fever, and the virus can lead to severe dehydration in infants and children. And before the vaccine, which was first approved 20 years ago, the virus was responsible for hundreds of thousands of hospitalizations every year. And Dr. Tyler Evans, the co-founder of a multi-state public health organization, says marginalized groups are the most at risk.
Prior to the pandemic, the rates of vaccination for rotavirus we're getting closer to around 80%. 2018, it was around 77, 78%. Now it's dipping into the low 70s as of recently.
So rotavirus is most common in infants and young children. However, older kids and even adults can get infected as well. Those with weakened immune systems are particularly at risk.
Now, you talked about those vaccine changes. So do the federal vaccine guidelines and those changes also apply here in Illinois?
Actually, no. So the state of Illinois did choose to adopt their vaccine schedule from the American Academy of Pediatrics. So there is still a universal recommendation for rotavirus here. But of course, the concern comes when you travel and you're in places with lots of people like the airports and the Rich family's concerns.
Got it. Thank you, Kate.
Thank you, Kate.